Hi, welcome to Healthwatch. I'm Cindy Berry from Ledgelight Health District. From time to time, we get ideas for the show from people who watch the show and come up to me at the grocery store or the farmer's market. And recently, somebody asked me the question, how are we doing on childhood obesity in Groton and in the country? And so today, I've invited Abby Alter, who's from the Child Health and Development Institute, and also Sue Corrice, our own Sue Corrice, right here, who is the health chair for Children First Groton, and also is from Riverfront Children's Center. Thank you both for being here.
Thank you. Thank you.
Abby, let's start with you a little bit. I'm curious about what the Child Health and Development Institute does.
So we work to ensure that children have healthy outcomes in the state. We work primarily in health, mental health, and early childhood. And basically what we do is we take research and science and we try to translate it into best practice for systems and policy change. So a lot of our work focuses on system and policy changes.
Mm-hmm. And Susan, what about Riverfront? I think a lot of people know, but for those that don't.
Yes, so Riverfront Children's Center is a nonprofit early care and education center. So we provide child care and education for children 6 weeks up to 12 years, all year round. And we're doing that through NAYC accredited programming, licensed programming, so high quality, but we're supporting the working families in Southeastern Connecticut, primarily Groton. Mm-hmm. And that's where I think our piece with Children First Groton fits so nicely. Children First Groton is working on initiatives around health and safety and education, and it's one of the important pieces of our job to be part of that work here in Groton.
Mm-hmm. So you've been chairing the health committee for how long now?
Probably 5 years I've been the health chair. Mm-hmm. Prior to that I was an education chair, obviously, since early childhood education is my background. But health is a big interest area for me. What we've seen at Riverfront and working with thousands of children is that if children's health is not where it needs to be and family health is not positive, then it has negative impacts on children's education and development. So it's really key that we have a leadership role there in Groton with Children First.
Mm-hmm. And I think for so many people, child health is kind of a proxy for the health of the nation. So it's really an important topic. Let's talk a little bit about childhood obesity. Mm-hmm. And kind of are we making a dent? What are you seeing, Abby?
So overall, obesity in our country has plateaued, but we're still in kind of a not great situation with children. So about 1 in 4 children ages 2 to 5 are entering kindergarten either overweight or obese. So those numbers have a lot of concerns for us that work in the field, in the early childhood field. And we are really keen to start early, to have early interventions and really get families understanding that it starts at birth.
Mm-hmm. So no longer are we just really looking at children that when they get into high school, right, but we're looking earlier and earlier. What about for Groton?
So for Groton, our numbers are very similar to these national standards, and we have been, Children First has been following that data. We don't have this year's BMI data, but it's troubling to see the number of children in our schools, in the elementary schools, that have a BMI that's unhealthy, and that are either nearing obesity rate that's too high, or they're actually already obese for their age. So Groton has been working on this to try to lower the rates, and I'm looking forward for the next few years to see if what we're doing with physical activity and nutrition is having an impact.
So we don't just live in a bubble here in Groton, the health bubble, which we hope everybody, kind of attains to.
Yes, it's definitely very similar to the numbers for the state and for the nation, but I mean, I think for us being able to really pinpoint it down to the exact neighborhood to neighborhood, schools to schools, I know Ledgelight does a lot of work at the neighborhood level, is going to help us pinpoint the strategies more to really make them fit the needs of Groton.
And it's not uncommon, I'm sure, that along with obesity is looking at rates of diabetes among high school students with high blood pressure and higher cholesterol. And the age seems like it's just dropping and dropping for some of those consequences.
Absolutely. I mean, we know that the earlier obesity rates, for the younger you are, the more chance as an adult and in high school that you're going to have those diseases. So that's why this idea of starting early is really important. So exactly.
So let's talk a little bit about some contributing factors. I mean, it seems simple, but maybe there's some complicated parts to it.
Right. So, well, we do know that, I mean, a lot of scientists have looked at this, and we know about our food source. A lot of people are eating A lot of people are eating processed food filled with corn fillers. That's one of the things. The advent of sugar-sweetened beverages over the past probably 20, 30 years has really increased obesity rates. And the lack of physical exercise. I mean, we're all on our phones, screens are everywhere, and you can't discount that as well. But there are other socioeconomic issues at play, and environmental as well. So this idea of having access to places to play that are safe, playgrounds in your neighborhood, as well as access to healthy food for low-income populations. I don't know if you've heard the term food deserts, but we know that a lot of communities are suffering with places to get access to healthy, affordable choices. So that's something that we're really concerned about.
And when you sent me some information, you were kind enough to do that before we started. Part of the information was really targeted towards the health of pregnant women.
Right.
How does that play into this?
So that is very important, because what science tells us now, we know a lot about maternal weight and actually preconception weight, which is really important. And I didn't even know that going into this myself, but through my work I've learned a lot about it. And we know that weight and maternal weight has an effect on the baby. So what happens is we can either have a couple of situations where the babies can be born at a low birth weight or at high birth weight. And either of those, sometimes what happens is parents think their baby has to catch up. So if you're a low birth weight, you tend to maybe want to overfeed your baby, whether you're nursing or you're feeding her in a bottle. But if you're a high birth weight, you're already at risk for developing obesity. So that, we can't stress enough that kind of advocacy and education about if you want to have a baby, you really need to try to get into a good weight. And also the weight you gain while you're pregnant also sometimes determines if you're going to be able to keep that weight on later. I mean, so those are all risk factors for obesity and being overweight.
Sure. And Susan, I wanted to ask you, as far as Children First, what are the ages that you're looking at in targeting with Children First?
So Children First, up until this year, has been looking at birth through age 8 through an initiative from the William Casper Graustein Memorial Fund. That funding actually ended in July, so we are looking at Groton from a wider lens now, birth through, I think, age 21, because we've really been focusing on the whole family, the whole child, the idea that just because you've turned 9 doesn't mean you still don't need to work on some of these initiatives. So though our core focus really is up until that age 8 or 9, we really are expanding out, especially with our mental health work this year, the farmers markets, and all of the work we're doing in summer reading. We've extended it up so that we're talking about kids up through the age of 21.
That's wonderful. And I know at Riverfront you have lots of small children, young children, and you probably have a lot of moms who are kind of on their second or their third pregnancy. What kind of responsibility do you feel that you have to the family as a whole and to pregnant women that are coming through?
That's a great question. So 20 years ago when I started at Riverfront, it was daycare, an early childhood education program, and you cared for the child and then they went home. Nowadays, that's not the way it is. It really is, you have to care for the whole family. So when you have a mom that's coming in, you also want to not just care for their child, but also get them information and resources for other children that they have, older, younger, all of that prenatal thing that you were talking about. We want to make sure parents are following through on that. So we've become a much larger resource for families than just the daily educational portion that we do. Especially around breastfeeding. That's a big part. We made Riverfront a very breastfeeding friendly place so that parents can come as frequently as they can to breastfeed. But we also try to be part of some initiatives to encourage that, because we see the benefit that it will have if a child is breastfed before they, up until age 1 even. That's a great benefit for our children. So we like to promote that internally.
And Abby, are you seeing policies around some of these things that that can help daycare providers, that can,
Right. So, well, that's one of the things that we're working on at our organization, to have some things in legislation as also, there's also licensing, as you probably know very well. Connecticut has a very stringent and in a good way, a good licensing program here, where they encourage healthy nutrition and the choice of certain foods that centers that are licensed by the state, depending on your size, have to follow. So. Definitely, but we'd like to see, some of the things that we'd like to see a little bit more emphasis on is the access to the healthy foods, no screens for the young children, very limited screen use for the older children, and physical activity, as you were saying. We'd really like to see at least 20 minutes, which it's probably not even enough, of consecutive play as a standard for early care centers, as well as I forgot my train of thought.
Yeah, that's okay. I was kind of curious about legislators and folks in Connecticut. Are you finding that there's a lot of compassion and passion for these issues?
Absolutely.
Is it growing? Have you seen it grow over time?
It has grown, and actually there is a new organization that is put together kind of like a task force called Healthy Kids. The American Heart Association has put together a task force with the Robert Wood Johnson funding in our state, and in fact, the CHDI, we're on the advisory board, as well as a lot of other leaders in the state, and we're working on not only legislation ideas, but programmatic ideas to across the state. So that's sort of something that's coming, and we're hoping to see a lot of momentum and hopefully some legislation that will speak to some of those issues, not only in early care, but maybe in elementary school, to get some real standards out there.
That's great.
And there has been some traction, because last year the bill that had a lot of these things written into it made it really far. So we didn't get the bill passed, but I think this year
a lot of hope.
we're holding out and hoping that we can work with our legislators to make it something that we all believe is important.
Awesome.
Yeah.
So we're going to take a quick break, and then when we come back, we'll talk a little bit more about what parents can do and what child care centers can do. Does that sound good?
Sounds great.
All right. So stay with us. We'll be right back.
Look at you. You're at the top of your game. You're unstoppable. Nothing can throw you off track. Wait, is that your car? Uh-oh. Yeah, I saw that coming. That will throw you off track. You're looking at around 10 grand in fines, legal fees, and increased insurance rates. Let's try this again. Smart move. Because buzz driving is drunk driving.
You might feel like there's too many problems in the world, or that you as a 15-year-old, 16-year-old can't really make a difference.
It's not always about you. It's not just one person. It's a group. It's a team. If we all show up together, that's what it's all about.
I was a part of helping to build what it is today.
I'm really lucky to get to be a part of that legacy.
Just that simple act that takes 5 or 10 minutes of your time is making a difference and is transforming someone else's life.
Once you get there and realize how much you can change someone's life, it's one of the best feelings in the world.
I'd do anything to convince you just to be a part of this.
You guys keep doing what you're doing. It's something special.
Get up and try something. Just try it. Just go to one event, one action team event.
It'll just make you feel so good about yourself.
Welcome back to Healthwatch. We're talking today with Abby Alter, who's the project coordinator for early childhood initiatives at the Child Health and Development Institute, and Sue Corrice, who's from Riverfront Children's Center and who is the chair of Children First Groton. Welcome back.
Thanks.
We were talking before the break about some of the things that contribute to childhood obesity. And Sue, I was wondering, what are you seeing here in Groton that might be contributing factors? And then Abby, if you can kind of talk about the national picture a little bit.
Sure. So there's a couple of things that I think are pretty important that we're finding in our work, and we're hearing it across the sector, not just from early childhood providers. One thing is that children are not getting as much physical activity out on their own time off from school, or also from their time in school. Schools are being pressured to do more academic time, so sometimes recesses are shortened days for school days are lengthened, they might lose some of that after school time, especially now that it gets darker sooner. So we have found here in Groton, the police department noticed in the last few years as they're driving around, they're not seeing children out playing in neighborhoods the way we might have seen 5 or 10 years ago. So that means they might be indoors doing things, whether that be more sedentary or not. I think we're guessing that it's probably more watching TV, using their computer games, but it's troubling that we're not seeing children and families out playing as much as we used to, riding bicycles. Another thing that we have noticed here is that some parts of the Groton City area are in a food desert, so we were noticing that some families did not have access to that fresh fruits and vegetables that they really needed to have, and their closest stores would not necessarily be carrying those if they didn't have transportation to get to another larger store. So there's been some work with the Ledge-Lite Health District and some of the other groups to try to have more farmers markets in this area, and farmers markets within walking distance of the neighborhoods so that they're not a challenge for families that don't have transportation. Those are two of the really big things we're seeing. A third thing, and I think Abby's going to talk about this a little, but I want to just preface that we are finding a lot of mental health challenges in Groton Public Schools, in the private centers, and parents are talking about these issues even if they're not in a program when they're younger. Those numbers are rising, and one of the questions is whether or not portion of that be the diet and the physical activity that they may not be getting. So we're really trying to investigate that and see what the link is there. And I know that Abby sort of made mention to this already.
Right. Yeah. So we know that there is a link between, we obviously know there's a link between physical health and obesity, right? But we also know that there's a social emotional link. So children that are not getting the right foods and not having the healthy nutrition really are at risk for socio-emotional development issues. A lot of it stems from stress. So you won't believe that, I mean, this happens in young children, you probably see it.
Yes.
There is bullying, there's peer pressure, and there's a lot of low self-esteem, not being able to participate in some of the physical activity. If it's a little bit harder for you, you struggle when you're little, and if you're overweight. So we see that really affects the stress levels in children, and we know that affects brain development, and it really does affect their readiness and willingness to learn. So, you know, taking this obesity issue so much further than just, someone's going to be overweight and have asthma, we really have to focus on starting early, and that first year of life is so important, and that's the work that we do, is really focus on the first 12 months of life, because we know that in the first 6 months, children who gain weight very quickly in that first 6 months are at high risk for being overweight or obese later in life. So we really focus on this idea of breastfeeding, and it's great to hear that you have a facility that promotes breastfeeding for moms. For parents to understand what the cues of their baby are telling them, and to be educated about what does that mean, and what are the right things to do for my baby to have this relationship and have this bond with my baby, because people might not understand that first year of life you're really developing, it's a relationship, right? It's not only the baby, right? The baby doesn't grab food, and so it's the family that's feeding the baby. So we like to promote breastfeeding. We like to talk about the proper introduction of solids and really understand what we call baby cues, and the understanding that your child may be crying, but it's not always because the child's hungry. So there are a lot of programs, a lot of interventions out there that are trying to train parents and train early care educators all about helping parents understand what is important about that first year.
So let's talk a little bit about what parents can do. And one of the things that Abby, you were talking about during the break was kind of recognizing when you're being hoodwinked in terms of consumerism and what to buy for your baby. Speak to that a little bit.
So there's a lot of work been done from the Yukon Rudd Center for Food Policy. They actually just came out with an excellent report all about food marketing. And actually they focused this food marketing report on young children. And so we know, some of us are very familiar with some of the food marketing we see maybe for older children, but you don't realize that some of the things that are being marketed to parents for young children are very misleading. And a lot of times we'll say something's healthy or multigrain or helps with dexterity, or and truthfully you really need to look at the ingredients, and you need to think about, first of all, is this even an appropriate thing for my child? But of course we all want to grab that thing because it makes it sound like our kid is going to be a genius if we eat this food, right?
Yeah.
So that's another thing that thank God we have the Rudd Center really working hard to to push some of these companies that are marketing these foods to say, wait a minute, you know, we really need to be truthful with parents and not, you know, have false advertising.
Maybe better labeling.
Or really, and the education needs to come to parents to understand what to look for in that labeling. So.
And Susan, what are some other things that parents can do, some specific things that they might be able to do to really getting kids off to the right start?
Well, I think part of it is really engaging yourself, having family meals together, trying to focus on, even if you aren't the best cook in the world, trying to cook with your children and teaching them about fresh, healthy foods. I know I'm not the greatest cook in the world, my husband is, thankfully, but we try to work together on that so that our children do get into this feeling that it's important that every day we sit to eat, we sit together as a family to eat, and then we also go and we do something healthy afterwards. So we try to promote our families at Riverfront and in Groton to not only try to learn more about how to have a more healthy diet with your family, but also how to have more physical activity. One of our initiatives this year is to try to get families out together, doing more all across Groton, health-wise, but also safety-wise and for educational purposes. And it's a passport we're putting out to try to get families to go and do more together. And when you're doing that, you're going to be doing more physical activity. You're walking, you're moving around, you're exercising, going to places that will promote these physical health that we want them to promote. But we also know that families in Groton want to do what is best for their children. This is not a matter of people that aren't taking the time to learn or just don't, you know, have the ability. Yeah, they really care. And when you go into the store and what you can afford is really that quick, easy, what you take, that package of processed food, you think, okay, this must be fine. It says on the outside it's healthy. It's got this many servings of vegetable. We've been working hard to try to help families understand that they can make affordable choices that are a little more healthy. Great. So we do have a local store that does use a sort of system where you can gauge how healthy one kind of bread is over another kind of bread. Wow, so that's one thing that's going on. All of our local stores actually have access to, if you just ask for the nutritionist to help you, shop the outside of the store. And so there's some things happening, I think, across the state, but here in Groton that are helpful. And another thing that parents can do is to just do the kinds of things they probably did when they were younger and try to do them with their children. Now our children are so used to having an electronic device and they should have a phone by what age? And I stop and say, I was 30 when I got my first cell phone, and my children are shocked when I say that. But we played. We went outside, we played, we talked, and those things promote different activity, different physical activity.
So we just have a couple of minutes left, and Abby, I'm wondering what are some specific things at child care facilities or even people that do child care in their home, what can they do?
Absolutely. I mean, one of the biggest things that we talk about is sugar-sweetened beverages. Really, the promotion of water should really be the first thing on everyone's list. And you know, sometimes we hear from family and child care providers that parents bring juice and say, can you give this to my child? So there needs to be a little bit of education there. And I mean, you're still running a business, right? So you have your clients, but explaining to parents the importance of water and that what the research shows that the sugar-sweetened beverages are really what is causing children to gain weight at a rapid rate. And starting them in toddlerhood, you know, with the sugar-sweetened beverage is only going to take you to a much worse place. So really looking for that. When you do feed a child, if you're in a program that feeds children, to looking at introducing multi-grain, rich foods, foods that are not fried, and you know, some of this is cultural, right? So there are you know, cultures that like to fry food, and children are in that culture. But understanding that we can promote healthy eating within the center or the home is really important. The other thing is, I know people might laugh at this. I don't know if I have enough time, but people might laugh about babies, tummy time. As long as tummy time is supervised, and I know some centers are very busy and they say they can't supervise the baby, but starting that muscle tone early, giving the children opportunity at least 2 or 3 times a day to have a few minutes of tummy time, as long as it's supervised, it goes a long way. And of course the older toddlers having time at least more than 20 minutes a day consecutive of running around and getting those, exercise and just getting out all of the energy that they have to have a really successful day to learn in the,
This
in
is
the
great.
agency.
And what about some resources, finally, for parents? There's so much information out there. Can you speak to maybe 1 or 2 resources that you feel are really solid?
So the Rudd Center, as I mentioned before, the Rudd Center at UConn is a great website, and they have come out with some guidelines for feeding in the first year that is a great resource for parents. If anyone's interested in policy, we have a policy brief that we wrote about this year that you'll be able to find on our website, all about some of these issues that we talked about today.
Great. I think that parents are more empowered than ever before. I really, just from talking to parents, just, you know, that their parents are more educated now. I think we have more information, but also more empowered to really make some good choices. So
yeah, absolutely. And I would suggest to anybody in Groton that wants to get more involved that Children First Groton is a great place to start. We have a website, the www.childrenfirstgroton.org. But we also have Facebook pages for each of the neighborhoods, because each neighborhood in Groton is working on these initiatives around health, safety, and education. So for
people
a parent,
can join.
it's a great thing for them to join. I know the larger group meets the first Tuesday of the month at the Groton Public Library, but each one of the neighborhoods meets and they work on things that are important to the people living in those neighborhoods, and I think that it's very valuable. So I encourage people to think about joining that.
Great. Well, thank you both for being here today.
Thank you for having me.
Very fascinating topic, and it sounds like you're both doing beautiful work out in the community and in the state. So thank you for that. And thank you for tuning in to Healthwatch. We hope that you'll tune in again next time.